All right, awesome. Well, we're going to go ahead and get started. Thanks to you all for being here. This is week 8 of the Digital Opportunity Champions program. And today we're going to be talking about digital maternal health, which I'm really excited about. This will be similar to the last session we had, where we're just kind of giving you sort of a use case for all of the different topics we've discussed in previous workshops and kind of showing you examples of how they can be applied in a specific specialty. Before we get started, I did have some just quick brief reminders I wanted to address. After this session, I will be sending out a full list with all of the links to the video recordings on YouTube, as well as the assessments that go with each. As I've mentioned before, I think in the first 4 assessments, we forgot to add in a piece, like Microsoft Forms didn't capture basically your name or your email address. So for those, we'll be operating on an honor system, but for the remaining 4, they do have a question in there for you to enter your name and your email address. And that is what we're going to be tracking to give out those certificates of completion. So once you finish out all of those 8 assessments, if you will just shoot me an email, let me know you finished all the assessments. I can go ahead and send over like the little certificate of completion to you all. But again, you'll have access to all of the recordings of all 8 sessions, and again, all of the assessments in one email. So you can like bookmark that and then, come back to it whenever you can. So you'll have access to that. And of course, even after the sessions are over, you all have my contact information, so please feel free to reach out if you have any questions, thoughts, if you want to talk more about telehealth initiatives or anything like that that your group might be working to implement. Happy to talk more offline about anything we've done in the workshops or just any thoughts or ideas that you all have. So with that, we will go ahead and get started. So today, our objectives are to understand the role of telemedicine and remote consultations for pre and postnatal care, understand the impact that mobile health apps can have on maternal health, define the ways that remote patient monitoring can be used in pre and postnatal care, discuss briefly just how AI can be used to predict pregnancy risks, and finally understand how telehealth can provide mental health and postpartum support. So, to start off with, we just wanted to kind of give a brief overview of what the state of maternal health looks like in the US. So, according to the Association of American Medical Colleges, half of the counties in the United States lack an OBGYN. Of course, infant mortality is fairly high, 5.6 deaths per 1,000 live births, according to the CDC. More than 80% of pregnancy related deaths are preventable, according to the CDC's Office of Women's Health. Rural areas, of course, face 9% higher risk of maternal mortality. And of course, there are racial disparities in access to OBGYN care. And I'd be remiss if I didn't acknowledge that North Carolina is pretty high up on the African American maternal mortality rate is pretty high in North Carolina. We are one of the highest states. So this is a pretty relevant issue, I think. And I like to put what we're going to talk about into context, right? Because oftentimes, again, we're talking about how telehealth or telemedicine can help expand access to care, but it's important to understand kind of the circumstances that we're in related to maternal care before we kind of talk about how can we address those with telemedicine or telehealth. So, as we've kind of been learning throughout these couple of weeks, digital health is revolutionizing maternal health by improving access to care, early detection of complications, and personalized health monitoring. So, it can be really, really useful in this context. So we have a bit of a short video to kind of introduce the topic. And then again, we'll have slides as usual to kind of go delve further into the topic. So as usual, please give me a thumbs up if you're able to hear the audio from and see the video. Alrighty. Any questions or thoughts about the video that we just watched? Again, we are going to delve a little bit deeper into some of the topics that were mentioned, but just in case anyone has any questions, thoughts, ideas. Okie doke. Well, we will just jump right in. So now we're going to go into some of, the applications of telehealth and telemedicine in the maternal health sphere. So starting off, of course, remote consultations. So often in rural areas, patients see a primary care doctor for their routine gynecologic care because, as was previously mentioned on a different slide, oftentimes in rural counties or areas, there isn't a specialist, there isn't an OBGYN or a maternal fetal medicine provider available. So oftentimes that primary care physician is your anchor for lots of different types of specialty care, including maternal health care. However, using telehealth, expected mothers can consult with specialized healthcare providers. Telehealth can also reduce the need for frequent travel or hospital visits while still ensuring continuous pre and postnatal care. So, this reduces the stress of travel on expected mother and decreases exposure to sickness, obviously, from those hospital visits. Mobile health apps. So there are some mobile or computer applications that can help expectant parents understand nutrition, fetal development, as well as prenatal care. There are some applications, including patient portals, that allow expectant parents to communicate with their provider and ask them questions as they arise about, their pregnancy or concerns or issues that may come up. Mobile health apps can also help patients remember to take their prenatal vitamins or any other medications that are necessary throughout their pregnancy. And if certain symptoms are reported in an app, patients can receive emergency alerts, of course, that they need to seek urgent care. So, again, I think there's a level of communication and connectedness that these apps provide that was previously maybe not available, as well as I think a lot of knowledge to empower patients, again, to really take charge of their own health as well. um, Wearables and remote patient monitoring in the context of maternal health. So, of course, smartwatches and wearables can be used to track vital signs like your heart rate, blood pressure, and oxygen levels. If a patient or a doctor is concerned about their health status, of course, this information that's collected over a period of time can be really useful. For patients with gestational diabetes, continuous glucose monitors can be used in place of your traditional finger prick to check your blood glucose. The continuous monitors, again, also send reports about blood sugar levels to their healthcare provider directly so that they can be, continuously monitored again. For patients with elevated blood pressure or that are at risk for developing preeclampsia or eclampsia, a home blood pressure cuff, along with an app that can track and report the blood pressure values to your healthcare provider, can be used. So again, there's the wearables aren't necessarily different from the ones that we've talked about. It's more so like the context of how they're being used. In this case, that matters and can be really useful. Additionally, there are fetal monitoring wearables now that track fetal heart rate and movements at home. So, a healthcare provider will receive these reports from the wearables and can monitor for any changes in the health status. And again, this helps reduce unnecessary hospital visits. So, maybe the patient is having some sort of symptoms, right? They're feeling something weird and they're concerned. So, they tend to, go to the emergency department after hours often or things like that. This can really reduce the need for that if they know that these values are being monitored regularly by their physician, then that provides a sense of safety and I think comfort as well. And they also know that they would be alerted if there were any issues and they needed to actually seek urgent care. And of course, telehealth platforms allow for regular checkups to ensure better management of maternal conditions, which reduces the hospital and patient burden and makes it a little easier, right, for that consistent communication and that continuity of care, really, between the physician and their patient. So to talk about AI again, really, really briefly, but there are AI models that can use patient data to predict complications such as preeclampsia, gestational diabetes, or preterm birth. Of course, we had to put a disclaimer in here. There is obviously a HIPAA component to this that needs to be addressed, and you need to have patient consent, right, to use their information in that way. But again, mostly we highlight this just to show you kind of what are the technological advances being made in predictive technology as it relates to AI, right? I think this can be really useful. Of course, there are several different factors we have to consider when we're talking about AI, but these are products that are in development that could potentially be useful and definitely fall into the digital health realm. So, as we said, if used appropriately, these prediction tools can be used to identify high risk pregnancies earlier on, which allows healthcare providers to implement target interventions, sooner rather than later, so that expectant parents can have a healthier pregnancy. So now we'll kind of go into real world application of this. And for that, we do have another quick video we're going to watch, and then I'll kind of see what you all's thoughts are. Again, let me know if you can see and hear the video. Okay. So that video kind of sets the stage for what we're going to talk about next, which is that so far we've talked about how telehealth and telemedicine can be applied, in the OBGYN context. But there are women who have high risk pregnancies that often have to see a maternal fetal medicine provider every other week or so, and sometimes more often than that. And so we wanted to talk a little bit about what do those models look like. But before I jump into that, any thoughts or questions about anything that's been presented so far? Just want to check and see.
I love that it is also able to, in that video, those images could transfer not only to their OB, but also to the high risk hospital. That to me seems like
Yeah.
such a fantastic use of um, this platform. That's wonderful.
Yeah, absolutely. Again, I think it really ensures that continuity of care, right? So like all of the providers that you're seeing are receiving the same information. So everyone has access to the most up-to-date information. And then again, it enables that communication between your OB provider and that maternal fetal medicine provider. So yeah, in general, I think for continuity of care and making sure that all your providers are informed up to date, it's really great. Well, to jump right into this then, so, as I said, women with high risk pregnancies often do have to see a maternal fetal medicine provider in addition to their OB/GYN provider. In most rural areas, there are not physicians that are specialized in maternal fetal medicine. So, oftentimes, as was mentioned in the video, patients have to travel really far distances to their nearest urban region to see a maternal fetal medicine specialist. Luckily, there have been a lot of technological advancements that allow women who are experiencing at risk pregnancies to access that specialized care without traveling, as was again mentioned in the video as well. So, telematernal fetal medicine of course, allows patients to have high quality ultrasounds and visit a maternal fetal medicine specialist from the office of their local OBGYN or primary care physician. So this means shorter drives and that patients that are experiencing at-risk pregnancies have access to a wider variety of specialists. The program that we talked about that was talked about in the video was in rural New Mexico. However, we do have programs like this that are set up in North Carolina as well. One of the ones that I'm aware of, I think, is in the Chapel Hill area, and they have, I believe, two or three clinics, OBGYN clinics, and they have a tie-up with I think, maternal fetal medicine provider from UNC. And so patients typically come into their regular OB office to have that telehealth visit with that maternal fetal medicine provider. And I think it can be helpful in multiple ways. One, of course, shorter drives and those that are experiencing at-risk pregnancies have access to a wider variety of specialists, like we mentioned. But also, I think there's a level of comfort in there, right? So oftentimes, patients have to seek out this care. It can be kind of worrying for them, right? Knowing that they're a high-risk pregnancy. So I think being able to visit that specialist from the office of the provider that you're already familiar with, I think, again, provides an additional sense of comfort and safety, and may encourage them to seek out that care and commit to having those appointments regularly, right? If you're able to have a safe, private environment where you can do those visits. So there are multiple benefits to this, again, that I think can be really helpful for expectant parents. So another thing that was mentioned in the video are these home telehealth kits. So these are programs that would provide kits for self-monitoring at home and for high quality OB telehealth appointments that patients can attend, again, from their homes. So typically these kits are provided at no cost to the patient, and they include a tablet, a pulse oximeter, so that measures your oxygen levels, a blood pressure cuff, blood glucose meter, a scale, as well as a fetal heart monitor as well. So these are the different kinds of things that can be included in kits like this. And again, it's just another way of facilitating those telehealth visits and allowing your provider to get more information than they typically would be able to get from a telehealth visit. So home telehealth kits sometimes also provide access to online education on topics such as regular pregnancy care, gestational diabetes, and high blood pressure or preeclampsia. The videos and information are texted to the patient throughout the pre and postnatal period. This is also something I think that has been tied into patient portals as well nowadays. So depending on what diagnoses are logged in your chart. Oftentimes patients will receive educational videos if they opt in, obviously. If they provide their cell phone number on the patient portal, they can opt into this service that would send them these educational videos. And I can imagine for expectant parents that are trying to learn as much as they can and provide, the best care to, themselves and also their children. That this can be, again, another sense of safety and comfort, knowing that they have this information coming in from a reputable, trusted source, from their physician office, that they can rely on and that can help them in their pregnancy journey. So another topic we wanted to really touch on is maternal mental health, which personally is really important to me as well, and something that I think can often be neglected. So an estimated 10 to 20% of women that are pregnant experience depression during or after childbirth. Perinatal anxiety often begins early in pregnancy and can be confused with symptoms associated with early pregnancy, such as fatigue. And there are several other pregnancy-related mood disorders that can occur, including, but not limited to, obsessive compulsive disorder, panic attacks, post-traumatic stress disorder, and substance use disorder as well. So again, laying the context for where can telehealth or telemedicine be useful in the context of maternal mental health. I think when we think of telehealth and maternal health, we typically think of, your OBGYN care, and then we kind of had a different application of it with the maternal fetal medicine. And there's a different application of it really when it comes to maternal mental health. So how is telehealth applicable for maternal mental health? Well, asynchronous telehealth can allow patients to answer questions and have those results electronically shared with their provider. Screenings for any mental health conditions can be conducted via mobile health apps or patient portals. Perinatal mental health conditions can be treated by synchronous telehealth, which includes individual therapy, group therapy, or virtual appointments with healthcare providers. Again, healthcare providers can also give referrals to specialists or prescribe medications via patient portals. Healthcare workers can also provide patient education via virtual appointments, written or video content shared with patients through a portal, or online educational programs that patients can view independently. So again, just to put that into context, these are different ways that telemedicine can address not just maternal health, but maternal mental health specifically. So digital mental health for maternal care. So there are some apps that offer pregnancy-specific mental wellness programs. Of course, teletherapy and online counseling for patients with mental health concerns during or following pregnancy can be provided as well. And there are also community support networks on digital platforms that connect mothers to peer support. And this can be especially helpful to reduce that isolation that often occurs when you have one of these conditions, and of course, postpartum depression risk as well. So, connecting to other expectant parents and being able to share your concerns, your symptoms, and things like that can be really helpful. So finally, as we talk about telehealth throughout these 8 weeks, right? Of course, we are telehealth champions, we're digital opportunity champions in here. We're going to talk about, how can telehealth, telemedicine be integrated? How is it helpful? What are the benefits? But again, throughout this, I think we've been very cognizant to acknowledge the challenges and the difficulties that can occur in implementing telehealth and telemedicine as well. Because I feel like there is a lot out there talking about the benefits, and of course we do need to talk about that. But the reality is when you're trying to implement telehealth or some kind of initiative, it's really, really important to consider what challenges you might face. And oftentimes I think that becomes a big barrier to for people wanting to implement it. So, what are the challenges for implementing telehealth in maternal care? They're not unlike the challenges for implementing telehealth in other contexts as well. So, of course, there's broadband access and limitations in rural areas. We talked about, the model where patients come in to their OBGYN clinic to access specialist care. Of course, that sort of mitigates that concern or challenge. But of course, if you are trying to do telehealth from your home, then your ability to do so depends on whether or not you have that broadband connection. Additionally, we talked a lot about, wearable technology or, the fetal heart rate monitors and things like that. Of course, that technology has advanced, but of course, those wearables are using an internet connection to send those reports to the healthcare providers. So if your internet connection doesn't have high bandwidth, is not able to support that, and if those regular reports are not going to the physician, then of course you're not using that technology to its most efficient use, right? So those are kind of the considerations there. Of course, lack of digital skills knowledge among patients and providers. This is something that I've read in the research as well as just anecdotally heard from providers and patients. And we've talked all about that. But again, when implementing these new technologies and the wearables and things like that, I think for patients and providers alike, it can be really challenging to understand how does this work? How do I get it to work? And that can be, again, a barrier to wanting to use that technology, right? It causes hesitation. Of course, there are reimbursement and policy barriers. So we've talked about briefly in the past, how are the reimbursement the policies behind reimbursement, how they keep changing. There were waivers put into place during COVID-19 that, if not renewed, will expire, and then the reimbursement policy kind of keeps changing. An additional thing to note is that the billing for wearables and any remote patient monitoring technologies, that's an additional step you have to do in addition to billing for visits. So that can, again, kind of get complicated. And there are very stringent standards that you have to meet in order to be able to seek reimbursement for these kinds of visits. So that's a consideration as well. And of course, privacy and security concerns, those are just relevant throughout. But again, patients do need to have a private, secure place where they can do these visits. Like I mentioned before, if you're doing it out of your OBGYN physician's office, that can mitigate some of that. But again, when you're doing it within your home or you need a different place like a telehealth hub or community space, you do need that private space where you can have these visits. And of course, there are security concerns whenever there's technology involved, whenever information is being transmitted from one place to another. We want to ensure that patients, private health information is being protected and being used in a manner that's appropriate in order to support their healthcare needs. So these are all sort of the considerations that we'll need to take when we're thinking about implementing telehealth in maternal care. So I did want to share this resource. I've mentioned this once before, but there is a website, telehealth.hhs.gov, that has a best practices guide on providing telehealth for maternal care. Topics include bridging the gaps with telehealth, preparing patients and providers, telehealth in high-risk pregnancy, telehealth in postpartum care, and telehealth for maternal mental health as well. So that guide is available. And I will also say that telehealth.hhs.gov also has best practices guides for several other different contexts. So, for example, last week we talked about digital behavioral health. They have a guide for that as well. So that can be a really, really good resource when you're looking at implementing telehealth or starting some sort of telehealth initiative. I think those guides can be really helpful for patients, as well as, again, community-based organizations that are trying to implement these sorts of initiatives. And that really brings us to the end of this session, kind of a quicker set of slides. So with that, I'm just going to open up the floor for questions, comments, thoughts about any of the material that was presented. Happy to just hear more from you all. And honestly, I welcome any feedback just about the workshop sessions as well. It's been a pleasure to have you all in these workshops. Again, the response that we've gotten has been really amazing. So we really appreciate those of you that have followed along all 8 weeks and attended these live sessions and participated in the discussions and things like that. We really, really appreciate it. And we would not be able to do this, of course, without your participation. So we really do appreciate it. But yeah, I will just open the floor to you all.
Hey, Mira, do you have any of the statistics for North Carolina on the number of the 100 counties that don't have OBGYN care within the county?
That is a great question. So our office, the Office of Rural Health actually does track health professional shortage areas, but I believe we track primary care, behavioral health, I think dental care as well. So I'm not sure that we're tracking OBGYN like the lack of like OBGYN providers in each county. But I can certainly look for that information and let you know. But the assumption is, I think that given that the maternal mortality rate is pretty high in North Carolina, and we're pretty high up on the list of states there, that there is a lack of care in the state, is based off of my research. But yeah, I can definitely look for that information and share that out.
That'd be great. A colleague and I visited a county yesterday where it still has a hospital that's at great risk now, but they
Mm.
shut down OBGYN in 2017. So it's kind
Oh,
of
wow.
a slow trickle of services being eliminated. And so, yeah, that'd be interesting if y'all have any numbers.
Yeah, I can definitely check on that. And that's really, again, that's disturbing to hear that they don't have an OB/GYN provider since 2017. And now that their hospital is at risk of shutting down, which may be, again, one of the only places where they can seek that care. So that's worrying to say the least. Yeah,
Yeah, within hours drive, it was the only place. There's still primary care, of course, in the hospital, but if the Medicaid stuff hits as hard as we fear, then this hospital is at great risk.
well, that's really disappointing to hear, obviously. And obviously, we're all worried about how our state's healthcare facilities are going to be impacted by budget cuts and such. So, yeah. But I think it's more important than ever to be aware of this, right? I think that's the additional piece of it, that the more aware we can be of where the gaps are, we can think of different ways to address those gaps. And again, I think telehealth, telemedicine is definitely a great option for that. The question becomes, how can you implement it in the rural counties when the landscape of each county is so different? So that's really the question we've got to answer. But I do think these kinds of workshops or educational, information is the starting point of that, if that makes sense. So we're not without hope, right? The hope is we'll spread this information, provide this education, and folks will use that to start to think of innovative solutions that we can use to expand access to care. So that's the goal, but we'll see.
Hey Fred, I was gonna say I did a quick search, and the most recent thing I could find is a Raleigh News and Observer article from 2023. And this says 21 of 100 counties are maternity care deserts, which means they don't have a hospital providing OBGYN care, no birth centers, no OBGYNs in the area, and no certified nurse midwives. That was the most recent thing I could find.
Oh, that's great. Thank you so much. It was the N&O you said?
I'll put the link in the chat.
Great. Thank you.
Thanks for
Yeah,
sharing that. That's really things that puts that into context. Sorry, go ahead.
Oh, no. Just to kind of continue this conversation about cuts, you had mentioned reimbursement. I was curious, do you know if Medicaid previously paid for this? Or, I mean, obviously now it's all up in the air, but I'm curious if is it only private pay that is able to offer these sorts of options?
I do think that Medicare and Medicaid were covering some of these services. Now, I haven't delved into the new legislation just yet, so I'm not sure what the landscape looks like now. But I do believe they were covering these services. Again, they have to be billed appropriately. But yeah, I think they were covering some of these services if deemed medically necessary, which that is a loophole of its own in a sense, right? How do you determine medical necessity? And that, I think that's where it can kind of get sticky. But yeah, I hope that answers your question. But I do think they were being covered under Medicare and Medicaid. Other thoughts, questions, anything? Can be about the topic we talked about today, anything we've talked about previously, or just feedback on the workshops in general. Anything works.
Well, I will
Well,
definitely say,
go ahead, Ann. Go ahead, Ann.
oh, no, I just wanted to say thank you to both you and Courtney for all the work that you've put in the past 8 weeks and all the time before that, preparing all of this material. It's been excellent and very, very informative. Thank you.
Well, I
And
appreciate that. Thank you.
timely, I think, with what's facing rural counties in North Carolina, um, the timing to prepare um, people at the local level, couldn't have been better. So again, as Anne's saying, thank you. I think it was great information.
Yeah, absolutely. And I think you're absolutely right. I think the timing is really great, because we're thinking about um, this information in so many different contexts. I mean, we just talked about, of course, budget cuts and things like that, like lack of funding. I also think, given, the recent onslaught of natural disasters, I think this can be really, really important information in that context as well. I mean, of course, we had, Hurricane Helene, we had wildfires earlier this year, and now we've had flooding. And so I think in these instances, thinking about telehealth and telemedicine in the context of like resiliency or disaster preparedness can be really important as well. So yeah, that's the goal, is again to provide that foundational level of knowledge, and then have that be applied again in these various contexts and kind of see again what are some innovative solutions or ways we can come up to expand access to care and to ensure that access is strengthened, I suppose. But yeah.
Yeah, certainly we're racing to beat the next whatever natural disaster there is, to try to get things in place before whatever comes next happens. I know it's a little kind of Chicken Little, sky is falling, but we're racing to try to get stuff in place.
No, yeah, absolutely. And I'd say it's not like the sky. So I mean, we've had what in the past year itself, we've had like three natural disasters. I mean, I'd consider wildfire to be a natural disaster as well. We are hurricane, wildfires, and flooding. So I think it's become more imminent now, I'd say. I mean, even with Helene, it became really clear that we need these sort of disaster preparedness resiliency networks. But now I think it's even more clear that that's, the direction that we're heading in. And that's, again, important context that needs to exist in these conversations for sure. Because we're trying to not just expand access to care, we want that access to be there even in these sort of disaster preparedness situations as well. So yeah, absolutely. I think that couldn't be more important right now. So trying to get this information out there again so that, folks like you all who are working for these great organizations and championing these initiatives, you have all the information that you need and the context to kind of, innovate and develop these solutions and think through that process. So glad to hear that it's been helpful in that way. Other thoughts? I will just mention really quickly, like I did at the start, again, I will be sending out an email with all of the assessments and all of the videos. So you'll have access to that. You can view those at a later date if you want to come back to anything. I will also be sending out a really short survey. I know every time you do a conference or whatever, they're like, please fill out the survey. And you guys have given me a lot of great feedback throughout as well. So I really appreciate that. But it'll be really short. It'll be like 2 questions max. And I literally just want to hear, what did you enjoy about the sessions? Is there any topic in particular that you really liked? And then what do you feel like was missing? Are there any topics we can add in there that would be helpful? That's pretty much all the feedback that we're looking for. So I will include that in that email with all the links as well. So if you wouldn't mind filling that out, I really appreciate it. And as I mentioned before, once you complete all of the assessments, please send me an email, and that way I can send you the certificate of completion. We want to make sure that all of you all that invested so much time in this have something to show for it and, something to say that you completed this program. So please send me an email once you're finished with all the assessments and I will send over that certificate. But thank you all so much. It's been a great set of workshops. Again, we were so happy with the response. And I really appreciate those of you that joined all of the live sessions and were very active participants in the discussions. It's really been a great time. So I appreciate all of that a lot. And again, we can do this without you all, obviously. Did someone raise their hand? Someone have a question? I don't know if...
It was me on accident, so I'm sorry. But
no, you're good.
Quickly. So sorry.
What did I do? Oh, I apparently stopped sharing my screen. Oh, you all are still seeing that, right? You can still see my screen. Okay. Well, this is the QR code to the quiz for this week. So you can scan that. And again, that link will also be in the email as well. But I will hang out for a few more minutes in case anyone has any questions or thoughts. But thank you all so much. Again, it's been a pleasure. And please feel free to reach out to me after the workshops if you'd like to schedule some time offline to talk through any of these concepts, or you're planning some kind of telehealth initiative or digital health initiative, and you just want to talk more about that. Of course, we're happy to provide the support that we can. So with thanks you all. I'll hang out a few more minutes in case you have any questions, but we will adjourn for today.
Thank you very much.
Thank you. Thanks, Mira.
Thank you.
Mira, I'm just going to say, it's going to be really quick. I'm so sorry. I got like the Teams link, but I never